Hello, hello, hello. It is November 19th and 2021. We have one more month left for Christmas. Well, Christmas is next month, but Thanksgiving is next week. Thanksgiving doesn't always get all the respect that it deserves, so I'm gonna say happy Thanksgiving in advance. I won't be on next week. I will be on for Tuesday, but I won't be on for like a full thing. So I just want to say happy Thanksgiving in advance. But thank you all for those of you who will be watching while I'm live, and those of you who will watch later. I say thank you. Before I start this, just please indulge me for 2 minutes. I just need to share this video on my other page. And for people on my Abby Tyler's Healthy Living group, I did not desert the forum. It's just that it's easier for me to be able to share information or share the same story on the other page as opposed to back, because for some reason Facebook doesn't allow us to share anything from the group anymore. So I'm just gonna put this here and I'm gonna put it on the group page. And for those of you who are on YouTube, I'm gonna upload this sometime tonight. I have my glasses on. See me, my trying to be all intelligent. Okay, so I'm just gonna put this here in a second and then I'll be right with you guys. And now it's coming out a little cold, but anyways, so hold on one second. Okay, I shared that, and let me just put that on one more page and it'll be good to go. Alrighty. Sorry, sometimes you can do this when you haven't gone live yet, which is, I don't understand that. Okay. Good evening and thanks for joining me today. My name is Abby Tyler. For those of you who don't know me, I was told to introduce myself every time and just give a little bit about myself before I start every video. So my name is Abby Tyler. I am a family nurse practitioner. I practice at a private practice in Philadelphia. I also come with 22 years of registered nursing. I worked in long-term care and agency nursing, and I also worked at 20 years in the cardiac floor. I am also certified registered nurse preceptor, and I also am licensed to work as a nursing assistant instructor. So in case if anybody want to give me a job out there. And also I volunteer for my local library and community group. I do health fair every Labor Day, and also for my local city we started doing our health fair when they do the fall festival, but because of the pandemic we haven't done it this year. So that's a little bit about myself. For those of you who know me on my personal page, you know that you already know all of that. So, but I'm happy to be here. I am here today to talk about medication safety, importance of adhering to your medication, and also sometimes the most important thing is being able to afford your medication. So I'm going to be looking at my paper. I always like to come prepared. So there I go, and here I am. Okay, so we're going to talk about, like I said, medication safety and affordable pricing and importance of adhering to your medication instructions. This is not going to be in any particular order. I'm sorry. I was putting it down and just jotting it down as it came to my mind, and also when I was doing other things too. So I'm going to go back and forth. I'm going to try to make this no longer than 20 minutes. If I go up to 30 minutes, okay. Certain things I'm going to go a little long on, and certain things I'm going to just be brief about. Okay. So, the importance of having safety, go over safety. The importance of keeping your medicine in a safe place, making sure that your medication is not in where children can get to it. Children who are younger who don't understand what medication is all about, and make sure they're not where they're supposed to get to it. Make sure your pets are not, your medications are not put to where your pets can get to it, because they could also get very sick and lose their lives if they get into medication that's not meant for them. Even if it's meant for them, they're not supposed to take it. Pets would just take whatever. And but most important, with little kids, when they get a little bit of medication that could be harmless to an adult, they could just open it up and take that, and before you know it, you could be looking at tragedy. It's also very important to have a poison control number on your refrigerator at all times so everybody can see it. Again, poison control number. So, but if anything, you want to make sure you call 911 first and then go and follow the instructions. Also, Next one, always keep a current list of your medications. Make sure all your medications that you're taking, they're current. The medications that have been discontinued, the medication like antibiotic or anything else you were taking with steroid treatment for like a short period of time, make sure it's not on your list. You should have a current list of your medication in your phone. There are many apps that you can put in your phone that you can lock it, that nobody else can go into your phone, just in case you have medications that you don't want family or friends to know about. You make sure you keep that safely in your phone. Like I said, there are many apps out there that you can do that. Make sure you know when your medications, when they give you your medications or they prescribe a medication for you, know the complete name of your medication, the dosage, the time, and the instructions on the medication. Always try to keep your medication in the original bottle, because if you go somewhere and you put different medications in different things, that's not safe. Now, that's the instant people have to take their medications and put it in little slots for Monday, Tuesday, Wednesday, and Thursday for the week and all. Also, make sure the leftover is kept in the original container. And like I said, your medication, the complete name, dosage, time, and instructions. You don't want to say my heart pill. You don't want to say my water pill. You can say my aspirin. They told me aspirin 81 milligrams by mouth every day. Now, there's also aspirin 325 milligrams. Some people take aspirin double 162 milligrams, all because of whatever diagnosis that they're being treated for. So you want to make sure that you know the dosage, the time when you're supposed to take it, and the instructions clearly. If you don't, once again, like I said, if you put it on the list, on the paper, or you put it in your phone, make sure when you put it in there all together like that. This is the drug, this is the time I'm supposed to take it, and how I'm supposed to take it. Every time you want to make sure every medication is listed like that when you put it there. So when somebody asks you what medication you take, you want to make sure you have that, and you can just say, oh, okay, I don't remember, but it's right there. Not everybody can remember every medication. Some people take a lot of medications that they're not going to remember every dosage, and we don't expect you to remember every dose. So it's important also for make sure you have it written down somewhere. I already talked about it, keeping the medications in the original container. Make sure you have at least no more than one pharmacy, because it's just safer that way, especially when you come to the doctor's office. When we're doing your medications or refilling them, we tell you where you want the medications to go. We'll do it right there. We click it and all that and put everything in, and it goes directly to the pharmacy. We don't have to give you any prescription to go anywhere, unless if there's a reason why we have to give you a prescription. Everything is really just sent directly to the pharmacy. So we want to make sure that you have one pharmacy, and that way if there's any kind of safety issue, we can always call the pharmacy and see what your last medication was prescribed, and we can go ahead and watch that. And that also goes to the fact that when you go into the hospital, every time you go into the hospital, we do medication reconciliation. So what the list of the medication that you come in with, we have to compare with medications that you were sent home with before, if you're ever in the hospital, or want to make sure that's the medications the doctor prescribed for you. Now, remember that a lot of people who go to different doctors, you go to your primary care doctors and you go to different specialists. So you want to make sure every time you go to each one of those doctors, or you have to go to the hospital, emergency room, wherever it is you go, and you want to make sure you have your current medication list with you. Because the reason why I say that is there are times where, and your allergy list as well, there are times where one doctor could be prescribing something else, and there's conflict with another medication. Okay, so they may have to choose a different kind of medication to you, because I think I said this in my other forum before. There are some medications, when you give two medications together, one medication has a stronger binding to the body chemicals and all that. Don't want to get in too deep into that, and that would make one medication work a whole lot less, and you don't need that if you need something to be therapeutic in your body. And sometimes when the two medications are put together, they can also make their whatever it is they're trying to treat, make it worse. It heightens so much. Let's say if you're taking medication for sleep, and I gave you two different kind of medications, and they kind of work on helping you to sleep. Okay, or one medication does make you drowsy. It could make you so drowsy to where you may not wake up in the morning, or if you wake up, you could be so sleepy and so groggy that when you get into the car, you wonder what's going on. You'd be like, wow, I'm so groggy today, and you could cause an accident and hurt yourself, cause death to yourself or to somebody else. So we have to make sure every time you go to your primary care doctor, every time you go to a specialist, every time you go to, even if you go to the pharmacy sometimes too, because they're looking for other medications from other doctors. And every time you go to the hospital, make sure you have all those the list of medications and the most current list of medications with you at all times. Like I said, it could be in your phone, or it could be on a piece of paper, but it's most likely to put in your phone. Everybody has a phone now. Okay. If you can don't have no more than one pharmacy, but if you should, and also there are people who can get medication. They get medication for like 3 months at a time because it's cheaper or the insurance, and some people get medications delivered to them. So the system may be a little different that way. And sometimes you want to get medication from somewhere cheaper too, so you may choose another pharmacy. But it's important that all those pharmacies kind of know each other. You want to say when you over, let's say you over a Rite Aid, you want to make sure they know that you're getting medications from somewhere else for 3 months or another pharmacy, because that way, like I said, if you go somewhere where you have to retrieve your medical records when you can't remember certain things, you don't want too many different pharmacies and all that. That gets confusing also. So no more than two pharmacy if you get medications for for 3 months at a time, or for some other reason where you need an additional pharmacy. Just make sure you have both pharmacy numbers in your phone at all times, and both pharmacy numbers on the refrigerator or somewhere where you can reach it. Okay. Don't store your medications in the car, because the heat from the heat from the car, the heat from outside, and the cold weather and all that too, that can change the chemical components of the medication. So if they tell you store your medications in the house, store it in the house. Don't keep it in the car. Some people might keep things in the car because they're so busy when they get in the car in the morning. That's when they take their medications on their way to work or school, but it's not a good idea to keep it in the car. Okay. If you have to, I mean, you can put in a little container and take it with you when you go to work, but or wherever it is you go in, but don't keep the whole container in the car. Do not share medications. Do not share medications. Do not share medications. Just because your family member was taking something and you're experiencing some similar symptoms, and you decide that, okay, let me go ahead and get my medication. Let me ask and take the same medication because my family member was taking it. That doesn't mean you don't have the same kind of DNA. Your allergy and that medication may not interact or react with that patient. They may not suffer a side effect, but that means you may suffer a side effect. You and I can take the same medication, and I can have like a really bad side effect, and you can't. So I want to make sure anything that is prescribed, do not share your medicine. I understand sometimes it's cheaper, and I understand sometimes it's more convenient, but it's not safe, because especially with certain medications, when you go to the hospital and they say, okay, why did you take that medicine? Oh, my wife was taking it. Well, you and your wife don't have the same DNA. And even if you and your wife, even if you're a twin relative, it's still not safe. Okay. So do not share medicine, especially other things like if you're taking things like, and also for eye drops, you don't want to share eye drops, because that's a very, very, very high way of risk, a way of getting an infection into your eye. The other person has everything that's to them. It doesn't bother them, but it may bother you, because sometimes when people put the eye drops in, they let it touch their eyes. So that brief period of time, there are germs and everything on there. So you want to make sure that you don't share any kind of eye drops. At the same time, don't share makeups and all, and don't share anything that's lipstick or any kind of medication. Let's say this person was having something in the mouth, and they had to put an ointment there, and it had leftover. Do not share that. Do not share that. I know people say, well, everybody understands they're not supposed to share something on the lip, but you would be surprised. We have to make sure we tell people that. Okay. When you're traveling, make sure you have enough medication to carry over. A lot of people are going to be traveling for the holiday season. Christmas, Thanksgiving is coming up, and Christmas is coming up. So you want to make sure, if you're going to be traveling for a period of time, you want to make sure you tell your doctor way in advance that you need enough medications to carry over. I'm not sure if if you do for, let's say, for any kind of narcotic, because people take medication for pain and things like that, and other reasons. Benzos, they take things for seizures and other medications, or ADHD, do some control medications. So I don't know if the doctor would be able to prescribe more, but most of the time you want to make sure you make them aware of that long ahead of time, so the arrangements can be made, because you don't want to go out of town and don't have your medicine that you need, because you don't want to end up in the hospital somewhere else. Not saying that they don't have the care over there, but you always want to make sure that you have enough medication that's going to take you. If you take medicine for your asthma, if you take medicine for your blood pressure, you take medicine for seizures, or for anything, like, you want to make sure any kind of medication that you have, you want to make sure that you can, you have enough of it when you're going, and at the same time making sure you store it safely when you're going. So you want to make sure you tell your doctor, I'm going somewhere. I had some patients who were going out of town, and patients who were going out of the country, and I had to, write and prescribe extra medications for them. And of course we had to document that, and it's a safe medication. I knew the patient and all. So there's certain laws that govern different states, and different things that we can prescribe or extra doses of. So make sure you speak to your doctor if you have to travel anywhere. And that includes anything that you have to do, like if you have sleep apnea, so your CPAP, your BiPAP, you want to make sure that you have that with you before you go, because you don't want to be anywhere you have sleep apnea. This is when you're sleeping, you're snoring, and you kind of pause in between there. By the way, if you have anybody who snores that loudly and had issues like that, please make sure you bring that to your doctor's attention so you can go get a sleep study, because the longer you stay with the sleep apnea, that can affect your heart, and eventually that can cause some severe problems. So make sure you have enough medications that you're taking when you're going out of town. Um, and make sure, like I said, in emergencies, if your doctor prescribe antibiotics for you, please, I'm gonna say doctors and providers, because I'm gonna say that back and forth. If you have any if the doctor prescribes an antibiotic for you, please make sure that you take it completely. Like they tell you, take your antibiotic completely, even if you're feeling better. You want to take it completely until it's completely done, because you want to prevent reinfection, because if the bacteria is not cured completely in your body, you can become reinfected. Or if you say, oh, I'm still feeling the same thing, and you didn't finish it the first time around, and we prescribe it, let's say 2 to 3 weeks later, we prescribe the same medication just to make sure that your body, just to make sure that we take care of the bacteria, and you having taken the one before, eventually your body builds a resistance to that antibiotic, and then eventually when we have to try so many different antibiotics, of course it has to be something that cure the bacteria that we're treating. Your body becomes, and it builds up a resistance to a lot of other and antibiotics, and that can be very unsafe, because you need something, and eventually sometimes you have to go to the hospital to be on IV antibiotics, because your body has built up so much resistance to other antibiotics simply because you didn't follow the instructions the last time. And I understand sometimes it's like, okay, I missed my antibiotic. They tell you, you read it and say, if you miss it, make sure you take it as soon as you remember, so you're not missing so many doses, because once you miss so many doses, then it just doesn't work effectively as it's supposed to. So and somebody inboxed me when I spoke about diabetes the last time. They were saying, well, if you become a diabetic and you have to do insulin, how they just prescribe the insulin for you, and then you just go home and you have to figure it out, or you have to like watch YouTube and things like that. No, if you're in a hospital and you do your blood work and you find out that you're diabetic, and your numbers are high enough to where you're going to need insulin, of course they're going to make sure that you are taught to inject yourself before you go home. Usually when I worked in the hospital, the nurses did that. We will show you how to do it over a period, I think a couple of days. We'll show you how to do it. We'll show you how to instruct it, make sure you cleanse your skin, and how to take the medication, draw the medication out with the needle, and how to make sure, dispose of the needle, inject yourself, what to do, what to look for, how to go from different spots, because in different sites, because you can't just stick your arm or your belly every time. You got to move around. Of course, dexterity matters. But excuse me, so you want to make sure that you do that, and we'll teach you how to do that, and we'll make sure that you show us that you know how to do it. You're going to re-demonstrate on how to do it before you discharge home. And because of that, usually the social workers that work in the hospital, the medical social workers, so they do all the acute care stuff, so they will make arrangements with the home care nurse to go over to your house, depending on your insurance and all that. But of course, we want to make sure that you know it, so insurance will cover it to go to your house and show you how to reinforce the teaching. So to make sure that you get it, because the most important thing is to make sure that you know how to give the insulin yourself to prevent you from having any kind of problems that you're going to end up back into the hospital for. So and also, if you're too afraid to give yourself insulin and your blood sugar is too high, that could cause a major problem. So we will show you how to do that. When you're in the doctor's office, we'll show you how to do that too. I'm showing my patients how to do it, because I'm a nurse, so we do have medical assistants who can do it too, but I can show my patients how to do it. And if we need any instructions, we'll also send you to like your insurance. Most insurance company have like local social services where they can come over to your house and show you how to do it, or you can go to a diabetic class. So yes, we make sure we teach you how to do insulin and all that before you can go ahead and send you home, or make sure before we even give you the medication, because the most important thing is making sure, in order for you to be adherent to your medications, you have to make sure you know what you're doing. So that's that is the diabetic part. And then I'm going to go to elderly and responsible party. If you have elderly parents at home, or if you're taking care of anybody, children and all that, making sure that if let's say sometimes I have people where like the one sibling takes the mother to the mother or father or parent to the doctor's office, another sibling's responsible for preparing meals, or another sibling's so make sure all those siblings that are taking care of mom and dad, make sure they all have access to all the medications as well. Make sure they all have the most current medications in their phones. So when one child carries somewhere, and sometimes it's not the same child that takes the parent somewhere. So you got to make sure that they have the most current medications in their phone. So when they bring the father or the mother to the doctor's office, or even to the hospital, you want to make sure they have the most current list. They also know the pharmacy. They have the number of the pharmacy they can reach. They also know all the different specialists that the parents see. So if we saying that we need records from this other doctor, we need this, at least that way they know who to sign to give a medical release. And please make sure that who the power of attorney is also giving consent for the other person to participate in their parents' care. You don't want to get to the doctor's office or get to the hospital and then we have to go through this long delay on saying, oh no, she's not responsible. Well, who told her to put her mouth in this? And no, we don't want that. The most important thing is caring for your parent and making sure they're safe. So make sure everybody has that number. Even like I said, you can also have the list of the medications right on the wall, but make sure that list of medication is on that is current, and that everything, like I said before, that is on is written clearly, the medication, the time you're supposed to take it, and the dosage and instructions and all that. You want to make sure that is there. And the importance of taking like certain medications, like I said, going back to that, if they tell you take the medication with food, you want to take it with food, because sometimes the medication, when it breaks down to your stomach and you don't have enough food in your stomach, that could cause some serious problem like ulcers and gastritis and all that inflammation in your stomach lining. You don't want that. Also, when we tell you take the medication like first thing in the morning without food, like things like Synthroid, anything for your acid brain, and levothyroxine is the generic name for your thyroid issues. You want to make sure you take that medication on an empty stomach, because anything else that you take with the medication, when that breaks down, it breaks down the potency of the medication. And when we do take your blood work to see if the medication is in therapeutic range, it's not, then that could cause more problem, and we have to increase the doses, decrease the doses, or you could start having problems, before we find out, say, okay, are you taking this medication the way you're supposed to take it? And sometimes when you're taking medication like your seizure medicine or anything like that needs to be therapeutic, you have to take it in the way it's supposed to be. If you're taking medication that you're supposed to take before your meals, let's say your insulin or medications 30 minutes with your meals, before meals, you want to make sure you do that. Your stomach medicine, anything you're taking for reflux, you want to take that 30 minutes before your meals. When you tell you that, the reason being because you want to coat your stomach lining, so when you eat any kind of acid, that stems down the acid that will be building up in your stomach to come back up into your food pipe, such as esophagus. So you want to make sure that when the doctors, the provider, prescribe the medication for you, say any special instructions, even though it's going to be, because we write everything down on paper and in the computer, and it's going to be on the bottle itself. But you can always ask and be like, oh, so when you do get the bottle itself and you look at it and you say, oh, okay, I remember they said this. Or if there's any kind of discrepancy that you want to make sure you call back to and say, okay, yes, I remember they say I should do this, I should do that, and I have to do this because I want to make sure that I'm healthy, that I'm safe. Okay, I already said make sure you put in parents, making sure for children, if you have children are not living together, the parents are not living together, make sure each parent has the list of medications. If you guys are barely speaking to each other, please just kind of put that aside a little bit, even for that one moment, and know and have all the information, shared information among each other, so you know which parent, and if step parent and mother doesn't belong with the step parent or whatever, just for that very issue. Very important issue. Please just put that aside and make sure everybody has complete and accurate and utmost stated information. So know that doctor's name, pharmacy number, and also make sure you want to have a list of diagnosis. So if you go to if one parent take a child somewhere and they say, oh, have they ever had ear infection? Have they ever had this? Have they ever had that? And then you don't want to be sitting there going, I don't know, I don't know, I don't know. And like I said before, you want to make sure that past medical history is very important. So if I'm asking you all those things, you want to make sure that you have that. So have it in a paper. Say, oh yeah, yeah, they had ear infection when they were 3 years old. They had surgery when they're 5 years old for this. You don't have to know the exact date and time, but at least have like, yeah, remember. So we're actually okay. So when she broke her leg, was it like, in the wintertime? So what do you remember what grade she was in? And most of the time people be like, oh yeah, I remember she broke her leg, and I remember it was summertime and she couldn't go out to play because everybody was in the pool. So things like that. So kind of where we can ask you information to kind of, jog your memory a little bit. So but it's always best to have that in a little folder. So when you go to the doctor's office, you have some information to go in, and trust me, we really appreciate that too. For you, for your sake, your family's sake, and our sake. It just makes the appointment go a little faster, and you get more out of what you're supposed to be, as opposed to going home and saying, oh, I forgot to say this, I forgot to say that. Okay. I already did that. So your eye drops, and making sure for your children who are taking medication for diabetes, seizures, asthma, as they go into adulthood, or as they go into young adulthood, the teenage years, please make sure, please impress upon them that it's important that you take your medicine, because when they get to a certain age, you don't want to take that medicine, and that can be very deadly if they take your medicine for diabetes, for seizures, and things like that. And so as they start growing up, just start telling them, you have to start taking your medicine. You have to take it the way we're taking it. And I know we can work around your school schedule and your play schedule, but it's very important that you have to take these medications the way you've been taking it before, to save your life and just, protect your health. So it's important, right? Then for and like I said, your therapeutic, when we do your blood work too, we want to make sure. So affordability, and in the future I'm going to write more about this, but affordability, usually we usually tell a patient you can get medications that are generic brand. The generic brand is just as good as the other brand. It's the same company that makes the generic brand. It's just when the medication's been on the market for a while, then they make the generic brand of the medication, and sometimes they make it at the same time too. It all depends on your insurance. But Single Care is an app. You can, I think you guys seen the commercial, you can put that on your phone. You can also get that in addition to your insurance. You can also get that, cheaper price. But usually sometimes like the price could be like almost like $2 to $3 difference. And if you're having issues, especially if you take a lot of medications and you're having issues that you need to save some money here and there, trust me, that's very important. So Single Care, you can put that app on your phone or any relative's phone. So when you go in somewhere, it tells you. It's the same thing with Good RX too. You can put in your phone, and then if I tell you, like I say, okay, I'm going to be prescribing aspirin for you. All you have to do, you just put in there, put aspirin, it tells you, wow, how much it's going to cost. Let's say, and then you put your zip code, and it can tell you like maybe within 6 or 7 pharmacies in that area, and it will tell you which one, how much it costs at each pharmacy. And then you can look at it, you can see, oh my god, this one is being sold like $3 less than this other place. And so, and if sometimes you're just driving maybe 3 minutes out of your way to go to another pharmacy to get it, because some people don't have one pharmacy. I know I said everybody should have one pharmacy, but sometimes when it really gets to the point where you have to save money, that's important. So Single Care, Good RX, Walmart, and Target, they have a whole list of medicine, where blood pressure medicine, diabetes, medicine for your thyroid. There's a lot of medications out there where you can take. You can go to them and get a list of medications, and you can get them for like $4. Very, very cheap, very affordable. So try that. Like I said, Single Care and Good RX, you can do that, and save some money. I know a lot of people who sometimes will prescribe a medication for them, and they may not be able to afford it, and sometimes they won't pick it up, or they will pick up the medication and they will break it in half. Some medications it's not supposed to be broken in half at all, and they'll break it in half and take half of this and take half of that, and say, you know what, I couldn't afford it. So it's important that we don't do that. It's important that the medication is not effective if you do that. So I'm going on to 30 minutes now. I did say I didn't want this to go more than 30 minutes. But so I hope what I said here today, you can get some help from it. If you have any questions, any other questions, you can always just ask me. You can comment underneath this post, and I'll respond to you guys later. But so just make sure, like I said, taking your medications like you're supposed to. Make sure you have, I'm just summarizing, I'm just make sure you have all your medications, the most recent medications, any medications that have since been discontinued, remove it from your list. There are so many apps out there you can have on your phone that will provide secrecy and privacy for your medication. And most people have locks on their phone, so you know you're not gonna have nobody gonna be going there. So that is pretty much it. And before I go, I just wanted to say Happy International Men's Day to all the men out there, fathers, brothers, Facebook friends, everybody else. Happy International Men's Day. And I know that people are celebrating that. They say we don't say that much when it's Men's Day, but we say a whole lot when it's Women's Day. So happy International Men's Day. And also November is also National Impotency Month. I think I said that in the diabetic video. So make sure that you start you're having problems in the bedroom. You want to make sure that can be a signal for prostate issues, and it could be also for circulation problem. It could be heart problem too. So it's not just okay, I'm going to take a bit of cola and everything will be fine. No, you want to make sure that you bring that to your doctor's attention. A urologist can help you with that. Go to your family doctor and they can send you to a urologist. We can do prostate exam in the office. I know some men don't feel comfortable when I have to do it to them. So, but anyways, but you can always go to a urologist. And you also want to make sure if you want to say, okay, I won't let men to do it to me or any women, doesn't matter. So we do that. We're a professional. So making sure, and to make sure every time, every once a month too, you feel in your testicles. You want to make sure you feel there, it should feel mushy. It shouldn't feel like you got any kind of anything in there that feels like worms, not worms. Okay, it says worm when we do in school. It's like worms or spaghetti. It shouldn't feel like that. It should just feel nice and mushy. You shouldn't feel any little knot, anything there. If you feel it and what is painful and not, you want to make sure that you bring that to your doctor's attention. Okay, so take your time and make sure after you take your bath, get your testicles and you move them around, make sure everything, and look at it. Sometimes one size is a little bigger than the other, so don't worry about it, but just make sure you feel it and play around with it, and not play around with it. Oh, just make sure you feel it. Make sure if you feel any kind of knot on there, just bring it to your doctor's attention. Okay, so it's 30 minutes now, so I think I've said enough, but thank you all so much for watching. If I don't come back here by next week, I plan to come back. It won't be a long video though. But thank you all for watching. Thank you all for your support on the group and all those who have joined the page. Also, I say thank you so much for those of you who are going to be watching this on YouTube. Thank you all so very much. For those of you on YouTube, can you please hit the bell notification button so you can get video whenever I post. For those of you who are on this page, also, I know some of you like the page. So I think sometimes you still have to hit follow too. So, but anyway, so please do that. And if you have any questions, just post it on the page here, because I'm sure if you have any questions, other people might have the same question. So, and if you have something private that you want to talk to me about, and please, just a quick announcement, I cannot respond to every inbox messages that doesn't have anything to do with healthcare or anything that have to do with that. So any personal messages, there's going to be any personal questions and all that too. I cannot get to that. Okay, so I kind of just preview the questions and I kind of know that is, if it's there. So I understand. I apologize for that. Okay, so I hope I have said important things tonight. And I thank you all again for your support. You take care. It's Friday. Be healthy, be safe. COVID is still out there, so be safe as much as possible, but have fun, enjoy life. And for those of you who have to get the booster shot, make sure you get the booster shot. And flu vaccine, please make sure you get your flu vaccine. It's flu season, so make sure you get that to protect yourself and your family. I thank you once again. Thanks for watching. Until we meet again, until we see again. Goodbye. God bless.